There are 5 pillars in the strategic plan. The financial one is pillar number 1, financial sustainability and growth, because we all know how important finance is. It is extremely important for any organization or company, nonprofit or for-profit, to be financially sustainable. So as this reads, HOPES believes in the value of being fiscally responsible. Being financially sound allows HOPES to continue to provide compassionate care and continue the mission and vision of the organization. Financial viability also demonstrates appropriate stewardship and leverage of funding. That last sentence really means that when the organization is financially sound, it shows donors and others that we are capable of appropriately allocating funds that we receive in order to further the mission of the organization. The financial pillar has 3 goals to it. Goal number 1, by December 26, HOPES will have completed a financial assessment to diversify funding sources. Each year, HOPES will break even or have a 3 to 5% net profit. By December 2026, HOPES will adopt a contingency plan related to the future of 340B profits. Currently, we do rely a lot on 340B profits, so we're going to look around and see other opportunities that are available for us. And then the last goal, by December 2026, HOPES will continue to be a steward of federal dollars by maintaining or enhancing federal financial performance measures based on national indicators. And really, we already do this. So, and the grantors loves HOPES, so we won't have any problem continuing on. All right, and of course, I have a joke for you. Since we are in an art museum, have you heard about the accountant that wanted to become an artist? Well, she gave up on it after she discovered that the only art that she was good at was paint by the numbers. All right. Thank you. And Mandy is up next.
Hey, good morning, everybody. It's super good to be in this room with all of our staff. For me, only being on board for about 4 years, this is a first for me, seeing all of you guys together. So appreciate the energy and appreciate your time today. Just moving right along in the strategic plan, you're going to hear about several more pillars, but this piece is around philanthropic initiatives. You can read what that means up here, but essentially it's going to help support Pillar 1. We're going to diversify revenue. We're going to support financial stability and growth. We want to improve visibility and our brand awareness across the community and across the state. And all of this is so we can continue the work that we're doing, right? So goal 1. The first is, by December 2026, HOPES will have explored partnerships within the community, both corporate and non-corporate. You'll hear in our second goal our work around corporate engagement, but this could mean a lot of different things, right? This could be partnerships with other organizations or nonprofits, other hospitals, individuals, foundations, all of those pieces. What we want to do through these partnerships is create an opportunity for us to, again, rise that visibility. For me, when I think about this goal 1, it's all about collaboration. If you remember anything about goal 1, it's collaboration. Goal 2. By December 2026, HOPES will have developed a corporate engagement plan with a cause marketing emphasis. So for those of you guys that are unfamiliar with cause marketing, think about the Yoplait lids, right? A few years ago that they donated, 5 cents to breast cancer research for every Yoplait lid. That's what we want to do with Northern Nevada HOPES. And this is all about brand. This is about brand visibility and making sure that when we're walking down the street and we're meeting our neighbors and our friends and our family members, nobody says, "What's HOPES again?" Right? So we're really creating that credibility and that street cred for us. That's goal 2. Goal 3. By December 2026, HOPES will have created a foundation to support endowments, planned giving, and other major donor development efforts. You heard from Sharon a little bit about the iteration and our history of HOPES. Hope Springs, the East 4th Street building, all of that has to be paid for, right? And our clinical operations are healthy, and that's wonderful, but we need an additional funding stream to diversify that revenue and really make sure that we've got the opportunity and we've got the funds to do things like capital campaigns, special projects, and opportunities. So when you're thinking about this one, longevity. Goal 1, collaboration. Goal 2, brand. Goal 3, longevity. That's my piece. Megan, take it away.
Hi, everyone. So as you have all heard us say countless times throughout the day, and for as long as I've been here, our people are our most important asset here at Hopes. And so naturally, people and culture are essential to our strategic plan. And I am here to talk to you all and get you really excited about the future initiatives around people and culture. And so our first initiative is around performance evaluations. I know everyone's favorite, right? So we have been actively working to roll out a new performance system, and that has all started with getting all of the Hopes job descriptions up to date. We're working to ensure that our performance evals are tied to our job descriptions and that people have a clear understanding on expectations. You will also have input on your performance evaluations. There will be a self-evaluation section, and we want to ensure that evaluations are more of a give and take conversation rather than just a top-down approach. The second initiative is around our people and our culture and making sure that we're continuing to create a work environment anchored to that Hopes culture. And our culture is built upon our values. And that first value is kindness, right? We never know what somebody's dealing with or what they're wrestling with in their life. It could be birth of a new child, death of a loved one, marriage, divorce, depression, anxiety. We just don't know what people are dealing with on a day-to-day basis. And so if someone is short with you or curt or their actions are possibly perceived as being rude, instead of getting defensive, the expectation of everyone here in this room is that we take a deep breath, we get curious, and then instead we show kindness and grace. I recently heard a quote that I'd like to share with you all that really resonated with me, and it's that we judge ourselves by our own intentions, but we judge others based on their behavior. I really want that to sink in for a minute. Nobody comes to work each day saying, I want to make Kristen's day the worst day ever, right? We all come to work trying to do our best and trying to give our best. So always, this is a gentle reminder, always assume positive intent from everybody. We're all just doing our best. The next value is dignity. And it is defined as the state of quality of being worthy of honor and respect. And the expectation here at Hopes is that you will be professional, respectful, and kind. And if you feel that that isn't happening, then we ask you to please communicate that you're not feeling that. I don't know anyone that has the mind-reading superpower. So it is up to each and every one of us to communicate when we're having issues. We can't fix what we don't know is broken unless someone is brave enough to speak up. And then we move to the third value, which is inclusion. At Hopes, we love to collaborate. We love to get your input when making decisions, either through one-on-one meetings with your leaders, department meetings, emails, surveys. We love to survey. And we always want to hear your voice so that we can learn and do better, because we know, as Sharon said earlier, everyone here has value. Everyone here has great ideas. And we realize that ideas can come from anyone or anywhere, which leads to our next value of creativity. We love taking these ideas. We love taking these best practices and putting them into practice here. We love to take what works, leave behind what doesn't, and then refine, which then leads to our next value of adaptability. We know that growth and change is hard, but it's necessary, which is why there's the expectation that we are open to trying new things. We will always be changing as we learn and we grow, which is why we all have to be adaptable and resilient. And if we can honor and commit to these values, then we can continue to cultivate an amazing work environment where people feel seen, heard, valued, and respected. But it takes each and every one of us committing to these values to make that happen. And then we have the last initiative, which is that Hopes is working to create a comprehensive learning and development program for you all. We want to provide Hope-specific trainings, leadership trainings, internal career fairs, building career tracks, development plans, creating mentorship opportunities, creating different committees that you all got to meet outside in order for people to grow and thrive within our organization. I really hope you all are as excited as I am for the future of our organization. And now I'm going to turn it over to Kelly to talk about the next pillar in our strategic plan.
Hi, everybody. Before I start talking about my pillar, I just want to say it's amazing to see everybody here, and that HOPES is an organization that invests so much time and effort into the staff. A full day. I have to say that yesterday was my 1-year anniversary here at HOPES. And I've worked at many organizations in my 16 years in healthcare, and I have never seen this before. So you all should be very proud to work for an organization that invests in you. So I'm going to talk about operational improvement. And so many people's eyes glaze over when you talk about operations. But the essence of operations is to create and maintain effective and efficient processes and systems. If we didn't have effective processes and systems in the organization, most things would fall apart. And so it's a very important goal to have in your strategic plan that you look at operations and how you can improve them. This can be challenging because when you talk about improvement and efficiency and effectiveness, it means change, and people get afraid of change, and it can feel like you're in a constant state of change. I don't know if anyone feels that way in this room, but you can feel like you're in a constant state of change, but it's very necessary. And so as we look at our strategic plan for the next 3 years, we're going to look at operational improvement from improving efficiencies using continuous improvement techniques. Having this belief creates a culture where all employees, regardless of your role or title, are invested in positive outcomes and that you're empowered to implement the change. So we want people to feel operationally that you have the power to implement the change. You don't just have to wait for the change to come to you. So we go to our first goal, which is by December 2026, we're going to assess and address resource and technology needs for existing and new opportunities. So basically what that means is we want to make sure that we have resource and technology in our organization that supports our infrastructure. So as we change and grow, as we double our staff, we want to make sure that our technology and resources are there to support you. We can't stay stagnant in this goal. As Jake can attest to, we need to always constantly be looking at technology improvements, whether that's our EMR or our servers or whatever it may be. So we're committed over the next 3 years to making sure that we have that infrastructure in place. Goal 2 is by December 2026, HOPES will restart the Client Advisory Board to ensure patients continue to have a voice in care. Many of you may know that we do a patient experience survey, and we do get those quarterly numbers and input from patients. Those are anonymous surveys. So what we want to do is we want to restart patient focus groups, or what is called a client advisory board, to have patients actually come to us where we can sit down with patients and ask them, what are we doing well? What can we improve on? They're going to be our greatest source of feedback as we look to see what we need to do in the next 3 years to improve the organization. And finally, by December 2026, HOPES will evaluate enabling ancillary and clinical services provided to improve workflow efficiencies. Basically what this means is we're going to look at every service in the organization to see what we may want to expand in those services, new services we may want to add. And this all comes from things like needs assessments. It comes from our client advisory board, what they might want to see at HOPES. So we're going to do a deep dive into each service, see how we can improve it, what we can add, and maybe what we can expand. So lots of good stuff coming for operations. Now I'm going to turn it over for our last pillar to Kristen and Faith. Thank you.
It is so great to be here today. I'm Faith Whittier. I'm the Chief Medical Officer. I joined about 6 months ago, so I feel like I'm the new kid on the block, and I won the lottery joining such an amazing organization. Kristen and I are going to talk about clinical excellence. It is a part of both the behavioral health and primary care teams. The outstanding clinical care you provide every day is very much a team effort, and it requires all of you. Pillar 5 demonstrates compassionate, comprehensive care, continuous quality improvement, and evidence-based medicine. Clinical excellence at HOPES is nothing new. That beacon of excellence, because of the hard work you put in every day, continues to shine both locally and nationally. From local institutions, such as UNR, desiring to partner with us as a center of excellence for future training of their students and residents, to UNR's Project ECHO program that continues to recognize the outstanding clinical work of our MAP program and MAP providers, and their clinical expertise to provide evidence-based teaching to primary care providers across the country. And most recently, a smaller but still notable recognition by our Ryan White site reviewers that made it clear that HOPES is a center of excellence with some of the best practices in HIV care that they have seen across the country. These types of recognitions These types of recognitions, both small and large, speak to the hard work you put in every day to make HOPES that center of clinical excellence that it is recognized to be. By 2026, which is goal 2, HOPES will continue to focus on clinical quality through measurable health outcomes, increasing our preventative screenings for cervical and colorectal cancers, taking a deeper look into our chronic disease populations and those high-utilizing patients, assessing our quality data for gaps in care or services to better assist those patients in successfully reaching their healthcare goals, as well as expanding existing clinical quality programs, improving measurable outcomes for our MAP patients, both new and established, tracking their retention in care at 30, 60, and 90 days, identifying and assisting those patients early on with barriers that jeopardize their retention in care. I'd like to give a shout out to Gar, who helps us keep all those numbers and takes those deep number dives and dances and makes it make sense somehow. We are super excited about all our next steps in continuing and achieving higher levels of clinical excellence. However, the most important component of clinical excellence is you. And your hard work doesn't go unnoticed, especially by our patients. Thank you.
Hello, everybody. All right. So I'll tell you, I was involved in developing the strategic plan, right? All of the execs did it together. We put a lot of thought into it. We worked with the facilitator. And so I have to take responsibility because when I got assigned this goal to talk about, I read it and I kind of went, huh, that's like a lot of words in a relatively short sentence. And I think there's a lot of meaning compacted in there. But how do I actually break it down and explain it? So just read along for a second here and you'll see what I mean, right? HOPES will focus on providing team-based care through population health management, thus ensuring continuity of care. It's a lot of big, dense words in a very short sentence. So we're going to break it down. We're going to start at the middle, population health management. Okay, so population health management is kind of a newer concept in healthcare. It used to be that we would just focus on one patient at a time in healthcare, right? Mr. X is 60 years old, like a provider might think. Mr. X, 60 years old, has a family history of colon cancer. Let's make sure at his next appointment that we recommend a colonoscopy, right? That's good care. But what we're thinking nowadays is all of our patients above a certain age have a higher risk of colon cancer, right? So let's implement some strategic, consistent practices to make sure that as many of them as possible get their colonoscopies, not just one person at a time. It's looking at patients as individuals and as populations who have certain common preventative health needs and common medical issues that we can use best practices as a whole to try and capture as many of them as we can. So that is population health management. HOPES has really been focused on this the last few years. We now have a director of population management, Ellen, give a wave, wherever you are, Ellen, right, who is spearheading this initiative. All right, now we'll go back to the beginning, team-based care. So at HOPES, we have fabulous care teams. We all know that. But I think sometimes we get a little used to the fact that we have fabulous care teams. But if you talk to providers out in private practices and group practice in the community, right, it's typically a provider an MA, and a scheduler, right? That's it. They don't have the nurses, they don't have case management, they don't have behavioral health, they don't have pharmacists. We have this amazing care team that wraps around all of our patients. And so we want to be able to use all of those roles as effectively as we can to get all of the needs of the patient met as much as possible. And then continuity of care. Continuity of care basically means like we don't want people to fall through the cracks, if at all possible, right? We want our treatment plan for the patients to be enacted long-term. We want our patients to stay engaged in their care as much as we can long-term so that people are not falling through the cracks and that they can get what they need across time and across different services at our clinic. So if we put it back all together, what this is basically saying is that we're using team-based care, right? We're using our clinical team as effectively as we can to implement best practices for preventative care and for disease management for as many patients as possible across time. That's what we're talking about in this pillar. All right, and partnerships. Okay, so our final one in this clinical excellence is partnerships. So imagine that Hopes was an elementary school student. Some of you in the room have elementary school students, right? And you get their report cards and they have the little teacher comments on them, right? Some of them you're really happy to see and some of them not so much. But if Hopes was an elementary school student and it was getting its report card, what it would say is, Hopes works and plays well with others, right? We do. This is one of the things that we do. We work and play well with others. We are not like competitive. We're not out there going like being territorial with other healthcare organizations going, these are our patients, you can't have them. And there are places that do that. Some of us have worked at those places, right? But we don't do that. We have partnerships and our goal is to grow them as much as we can over the next 3 years. So we have lots of them right now. I'll just give you a couple of examples of ones that we are enhancing, right? So the university, we are getting closer and closer with the university in terms of our collaborative work. We already have a lot of those partnerships, but we're now implementing some clerkships for third-year medical students. This November, we're going to start a psychiatry clerkship. We're going to have third-year medical students following around different behavioral health programs. And we're looking at medical clerkship to roll that out in the future. Our long-term goal, our hope, is maybe some residencies at some point. We're partnering with the psychology department at the university on a research project to look at the experience of our transgender patients with the pre-surgical requirements. And we're talking with them about some other research opportunities too for the future. We have lots of internships, not just in the healthcare. We have interns that come to us for all of our different programs from the university. We have partnerships with St. Mary's. Not only are we using one of their buildings, Bell Street, right? But we're talking with their CMO on a regular basis about how do we make sure that our patients can get acute care when they need it, easily and conveniently, and have follow-up and ongoing care with us when they need that from their end. Washoe County, right? CARES Campus, anyone been involved in all of those conversations? Shout out to Michelle, right? For pushing that forward, and now she's working with the jail, right, for the same thing. We're working with them for the CARES Campus and make sure our new clinic is aligned super close. And I could keep going and going and going. The Health District, REMSA, Prominence, the MCOs, Community Health Alliance. I mean, we partner well, and we're planning to expand those partnerships over the next few years.
In closing, Pillar 5, we'd like to share a snapshot of that clinical excellence and how you've made our patients feel. So, a quote from the late, great Maya Angelou. You may not remember what a person said to you. You may not remember what a person did to you, but you will never forget how a person made you feel. So, this is how you've made some of our patients feel. Thank you to all the staff at Hopes. Reno needed a provider like you guys. I have had what I consider to be some of the best interaction of my life with a medical provider. Super, super thank everyone for making Hope so great. Dr. Edwards is more than a doctor. She has care and compassion for my care and is thorough in explaining my options. I'm fortunate to have her help me with my medical care. Thank you. Dr. Shane is very caring and helpful. Really appreciate Hopes. And then there's, thank God for you. Me encanta la doctora. Siempre es muy amable y se preocupa por uno. Y su asistente también es muy amable. So, for translation, I love my doctor. She is always so kind, and so is her assistant. I love Hopes. It's truly a blessing to have such an amazing place with such wonderful, caring people. Thank you so much.
I do not know what I would do without Laura Romano and Dr. Brooks. I may not even be here without them. They are the most incredible professionals I've ever known and have gone out of their way to make sure I get the help I've needed. I absolutely adore, this is a long one and I shortened it, it's still long. This person was very excited. I absolutely adore everything about the entire Hopes company. Being a patient at Hopes and a resident at Hope Springs has enhanced my life so much, I have trouble finding the words to express how much gratitude and respect I have for Hopes, and how thankful I am that I got the opportunity to be so involved with this godsend of a program. I have never ever known such patience, kindness, and unconditional love as I have been so freely given here at Hope Springs and Hope's Clinic the last 5 months. I owe this company my life and hope I can pay it forward in full. Because of this program, for the first time ever, I'm truly excited and grateful to be alive. I love Hopes and recommend them to everyone. Thank you from the bottom of my heart.